Welcome to Module 2.3 of Alberta Aids to Daily Living online training. This module outlines the policies and procedures for authorizing incontinence briefs, diapers, and liners. Assessing a client's need for incontinence products involves both the assessment and management of incontinence. This includes any possible strategies and interventions. Providing incontinence briefs, diapers, liners is only one component of managing incontinence. For best outcomes, clients with incontinence should be followed up by healthcare providers with additional training and education in this area. Assessing and managing incontinence is included in a registered nurse's or RN's basic training and education. Therefore, AADL provides incontinence products as a primary product range for RNs who have applied to become AADL authorizers. Applications from occupational therapists or OTs and physiotherapists or PTs are also considered if they have had additional training in the area of incontinence. If you are an OT or PT and have the basic competence, meet the requirements on the application forms, and are approved, AADL will add the product range for incontinence briefs, diapers, liners to your approved product ranges. A client must be 4 years old or older with daily unresolvable urinary or bowel incontinence. The client's incontinence must be medically recognized by the appropriate clinician as being unresolvable. Interventions and strategies may include, but are not limited to, a physician specialist assessment. Clients should have an incontinence condition not amenable to improvement by surgery or application of any device, or be unfit for such a procedure. They should be assessed and certified as such by a specialist continence practitioner. This would include a urologist, gynecologist, geriatrician, gastroenterologist, proctologist, pediatrician, nurse continence advisor, or nurse practitioner. Note: prescriptions or letters from general practitioners without diagnosis and indication of completion of further investigation of the incontinence will not be accepted by AADL. Lifestyle modification and conservative strategies should be tried for a minimum of 3 months. This would include bladder training, pelvic muscle exercises with or without biofeedback, diet and exercise, weight loss, and ensuring appropriate and timely fluid intake. When appropriate, medications for urinary incontinence should also have been tried and failed to significantly improve the client. Please note the following. Clients who choose not to follow medical advice to address incontinence issues will not be eligible for funding for incontinence products through AADL. Authorizers are required to assess a client when the product or quantity changes are requested prior to sending AADL a change request. Children who are projected to achieve incontinence past age 4 are required to meet criteria under point 1 prior to submission of an AADL authorization. Individuals with a diagnosed congenital anomaly or physiological abnormalities, including lack of bladder innervation that prevents the ability to achieve continence, are exempt from the requirements outlined in point 1. Please note, adult clients with diagnosed dementia or any other cognitive impairment for whom it has been determined by the appropriate medical professional that interventions and strategies would be ineffective or inappropriate are exempt from the requirements outlined in point 1. Clients with an end-of-life diagnosis with a life expectancy of no longer than 6 months will be authorized for a period of 6 months and are exempt from the requirements outlined in point 1. Authorizers must be aware that not every client experiences moderate to severe incontinence, nor requires the heavy-duty medical-grade products that Aadl funds. Authorizers must also be aware of the necessity to obtain prior approval when considering both diapers and catheters for their clients. Clients receiving funding for catheters who manage with a less absorbent product to address leakages between catheterizations may not qualify for funding for diapers or liners. There are many instances in which Aadl does not provide incontinence product funding, such as menstruation, pregnancy-induced incontinence, incontinence existing and/or lasting less than 6 months, wound drainage, bowel routines, enemas, active treatment and irrigation, clients who are toilet trained during the day but experience nighttime incontinence, clients in long-term care, subacute care, except as part of a discharge plan, short-term interventions, non-compliant clients, and children under 4 years of age. We'll now discuss submitting an incontinence authorization. The incontinence assessment form must be completed and kept on the client's file. This form can be found on the Alberta Blue Cross website. To find the quantity limits for the benefit you are authorizing, look on the far right of the group line. Authorize quantities according to the client's needs determined by the clinical assessment. Consider quantities carefully. Quantities are calculated by considering the amount the client is currently using, the number of incontinent episodes, and any other clinical factors that influence the number of incontinent products required. When determining maximum allowable quantities for briefs and liners, you must add the total of liners and briefs. Although you may authorize a certain amount per 2-month period, that does not mean the client should automatically order that many from the vendor. Please explain to your clients that they should order only the amount they need. 2-month periods are always consistent. January-February is the first 2-month period of the year. March-April is the second 2-month period of the year. May-June is the third 2-month period, and so on. This pattern does not change no matter when you first authorize the products. If you were to authorize products to begin in February, the 2-month quantity would be prorated according to how many days were left in the January-February 2-month period. You must offer your client a choice of vendors. Aadl-approved vendors for incontinence supplies are listed on the website at the address on the slide. You may want to print off the list for reference or refer your client to the website address. Once the vendor has been chosen, you fill in this information on the authorization. Always include the expiry period, as authorizations will not automatically be extended for 4 years. We will now have a review with a few questions and answers. Your client's husband complains that he is losing sleep. He is exhausted because his wife is soaking through her current incontinence briefs and has to be changed in the middle of the night. What do you suggest or change regarding her current benefits? Answer: you would reassess the client's incontinence, which may include fluid intake, for example, the type of fluid and the timing, a medication review, and any changes in the client's health. You could also request product samples from the client has concerns about finances and being able to pay for Aadl benefits. How would you advise them? Answer: refer the client to the cost share exemption option and/or pursue alternate funding. Question: the client asks you if they are cost share exempt. Where would you get the answer? Answer: you would access the Alberta Blue Cross online health portal to find out the client's cost share status. Now that you have completed the module, where can you access policies and procedures related to incontinence briefs, diapers, and liners? Answer: you would find them on the AADL or Alberta Blue Cross websites, or by using a hard copy printed off and kept handy for reference. Thank you for reviewing Module 2.3 of the AADL online training. Please contact AADL if you have further questions.